Okay, so as we are assessing through the normal positions, but then also restricting you to working in seated, you have to sort of push your understanding of relational motion. One thing stays still, one thing moves in relation to another. So to use the hips as an example, because attempting to treat the hips in a seated position is highly restricted. You all found this? Yeah, sweet. Hello. It's okay, don't worry. I'm just messing up my video. It doesn't matter. I'm not gonna edit it. So look there. There's resistance in this one, but it's not bad as far as range. They look relatively similar. They look similar to everybody, right? Here, there's restriction, but it's not bad. I have soft tissue approximation, thigh to thigh or adductor to adductor. When I come here, not terrible, but a little bit more restriction or reduction in range. Would everybody agree with that? Okay, so those are the two tests, right? So we'll have you sit up and face that way, okay? So now the simple question is, how do I work on either one of the hips? So we have something with both hips, right? So this one, we're having a challenge when we create adduction. So when we bring knee towards knee. So I have to think about relational motion. In this case, I may not necessarily be able to get as much as I want, but if we also consider the concept of position for correction, right? So what's the easiest thing I could get him to do to begin to create that adduction? So I could have him do two things. One would be a little bit more further range. Anybody think of anything? Close your legs. Bring the knees together, possibly as more reasonable verbiage.
Spread them.
Or what would create further adduction? So instead of just bringing them together, I can go across. Okay, so the first thing, put this one over that one, right? So we've got that. Now clearly this isn't going to work as well as we want because we get the rotational component, right? So instead, here, I can start to do this. Now I'm going to palpate at the hip so I get some idea. Okay. Now relational motion. What can I move? Now I now have a still hip. Sorry about the patella. I now have a still hip. What can I move in relation to the still hip to add some form of tension in here? The torso. Okay. So twist backwards to your left. Good. Come back. Twist backwards to your right. So this is me trying to figure out. Now, interestingly, both of them do something, all right? I want you to bend your torso to the left and bend your torso to the right. So this should relatively soften, and it does. Okay, cool. Come back. So what I want you to do is I want you to bend to your left. Keep going. That's good. Now twist to your right from there, yeah. And lean backwards a little bit. Okay, so I'm just trying to add some tension into it without it contracting. Now, obviously there's a load on him for having to hold himself up in this awkward position. It's not ideal, but it's something, right? Okay, so I want you to twist right a little bit more, bend left a little bit more. That's perfect, right? So I'm monitoring at the hip just to see what is and is not happening, okay? Now I can get really extra fancy. If I feel like it, it's gonna be odd. I want you to squish your left leg down on the table and let it go, right? You all see movement happen there. Squish your left leg down and let it go. Squish your left leg down and let it go. Cool, there we go, come back to the middle, right? So I get some tension on it, and then I have a still hip moving torso because it's gonna relate to it. Now, with respect to this one, we've got a rotational issue, right? Right? That one. There we go. So sometimes it's just you're in a different position and you're trying to think, right? So here we go. Now, interestingly, because I have some rotation of the thigh and you can see it, and you can see I can palpate up through some of these rotating tissues, kind of glute min, glute med, I can get something there passively. Now, what I'm going to do, bend your right. Good. Come back. Bend your left. Good. Come back. Twist to your right. Good, keep going. You can't, fine. Twist to your left. Okay, cool. So what I'm gonna have you do, bend to your right, twist to your left. Good, perfect. You feel the pull, right? There's a decent amount of tension, but it's not contracting. Is that fair? So it's not protecting itself, right? That's consistent. Okay, so push your right leg down and let it go. Right leg down, let it go. Right leg down, let it go. Right leg down, let it go. Cool, come back. Okay, we'll have you lay on your back again. This is really quick and rough. Maybe this will work, maybe it won't. But the concept is pushing your understanding of relational motion. You put yourself in a disadvantageous position and see if you can choose what to keep still versus what to move. Okay, so the first test, we're going to be thinking about the left leg and whether or not that's internal rotation. Okay. Does that seem better to everybody? They weren't, as far as movement was concerned, they weren't particularly asymmetrical. As far as restriction in motion, they feel better to me. Does it feel better to you on the table? And he's nodding yes. Yay. Okay. Does that actually feel better to you? Yeah. Does that look smoother to everybody? Now, there's always the possibility that I'm moving mildly different. I'm moving him different. That's always possible, so I want to keep that in my mind. That look better? That feel better? Okay. So in a lot of circumstances, you can do everything in every position, just less clearly and less effectively. So you want to choose a hierarchy of what's the most clear, what's the most effective. But if you have to, I want you to know that I've literally never done either one of those things in my life, right? But because I've never done either one, it gives you the opportunity to say that from basic concepts, you can generate everything. You just have to know what they are and see them. So you all saw clear use of contact, right? I was palpating the area that I'm attempting to add attention to. I'm using relational motion. I'm using patient active. I'm using barrier concept. It's all there. You just have to know what you're looking at and be able to interpret it through those lenses, which is why we use the heuristics.